And thank you all for joining me today for our weekly COVID-19 briefing. This afternoon, I'm also joined by Dr. Michael Mendoza, our Commissioner of Public Health, and we're also joined today by Wade Norwood, CEO of Common Ground, as well as the co-chair of our Finger Lakes Regional Vaccine Task Force. So before I turn it over to them, I want to talk a little bit about our metrics and provide an update on the vaccination and testing here in the county. So our numbers continue to trend in the right direction and are continuing to go down, which is also, serves as a reminder. We have to remain cautious, vigilant in our efforts, but our efforts are working. And the steps that we've taken as a community to mitigate the impact of COVID-19 are having the intended effect. Our 7-day average of new positive cases continues in a downward trend. Yesterday's average was at 139. If we compare that to just last month, a month ago, the 7-day average stood at 344. So in just a month, we've been able to take off more than half of the cases. So that's good news. Yesterday's new case total was 144. Tuesday was 126, and on Monday it was 112. So again, it's continuing to hover right around this number. So compare that to January. You go back about a month to about January 23rd, we were at 358. So our 7-day positivity rate yesterday was down to 2%. And now just to keep that consistent, a month ago it was at 5.3%. The last time we were at 2% as a county was on November 1st. So we're back now to 2%, right where we were before we saw that dramatic spike. Our hospitalization and ICU numbers, which the state monitors very closely, as do we as a region, those also continue to improve. As of yesterday, there were 225 people hospitalized in the Finger Lakes region and 68 in the ICU. Let's compare those numbers again. Just a month ago, there were 692 people hospitalized, 139 in the ICU. So we've gone from 692 a month ago to 225 individuals today. So clearly we're moving in the right direction, continue to do that. And the mitigation efforts that our community is taking to reduce the spread and keep our friends and families safe, I think is working, and I want to thank the community for partnering with us, working together, and keeping each other safe. So let's continue those efforts into the coming weeks, particularly as the vaccine becomes more and more available and more people in our community are vaccinated. We keep those who aren't vaccinated safe by following the protocols, and then we continue to get those vaccines into people's arms. We made a commitment to this community months ago that we would always make sure that our goal is to keep our distribution network and ability to distribute the vaccine outpacing the amount of vaccine here, so we can get it into the arms quickly as possible. We're continuing to do that at the convention center through our 3 county locations, through the convention center, the Fleet Center, and of course the Department of Health on Westfall Road. So I have some numbers to share on that as well. So to date, 16,982 people have received their first dose of vaccine. 11,095 have received their second dose of vaccine through the Monroe County Department of Public Health. So this is just the local Department of Health number, not all the other distributors that are here in the county. Today, we're also going to reach a milestone today at the convention center. Pod, as the convention center will be administering its 10,000th shot, including both first and second doses, and that it will happen at some point today. And, I really want to thank our team, our dedicated staff who are working long hours, Dr. Mendoza, your team, but also all the various county departments who are really playing a great role. We have folks who are working around the clock to make sure that operation is running smooth. And people can get in and out as quickly as possible and safely as possible. They're working just long hours, and I just want to thank each and every one of them for the work that they're doing and the contributions they're making to this community. And on behalf of this entire community, just say thank you. I'm going to have Dr. Mendoza walk through a little bit more detail on the distribution process of the weekly allocations in just a few minutes. I also want to update on the Hawkeye distribution site, the vaccination site at the former Hawkeye building on St. Paul Street, which is a state and federal partnership. They opened up the registrations for residents who are eligible in certain zip codes yesterday. During the 11 weeks that this site is planned to be open, there is an availability for 28,000 appointments. Yesterday, in the first 8 hours from 8 a.m. to 4 p.m., 6,400 eligible residents were able to make an appointment. So there's still a lot of availability. But in just the first a day, in less than a day, just the first several hours of this being available, 6,400 eligible residents were able to make an appointment. This is really, I think, a really good sign. The appointments are being made. The first 7 days of registration through next Wednesday are only open to eligible individuals who meet the state's eligibility criteria to receive a vaccine, who live in targeted zip codes. Those zip codes are historically underserved in the current vaccination rate. There trails other areas of the county. So if we are really truly going to achieve equitable distribution of the vaccine, it is critical that individuals in these zip codes fill as many of those 28,000 appointments as possible before next Wednesday. Appointments can be made for this location using the Am I Eligible website app in the New York State website, or by calling 1-833-697-4829. The Finger Lakes COVID-19 Vaccination Task Force is leading an all-hands-on-deck effort to bring in a number of community-based organizations, volunteer groups, and elected officials, among others, who are reaching out into the community, connecting, educating with people, and assisting individuals in helping to register and make those appointments. And so that's why we've invited Wade Norwood here today to discuss in further detail the efforts and the dedication of those volunteers and organizations that have been working to help make sure that that site is fully utilized, and I think really led to a great effort on day one that we really need to continue and work together, continuing through the next several days. Lastly, before I turn it over to Dr. Mendoza and Mr. Norwood, I want to remind everyone, still, while we're vaccinating residents and the vaccinations continue to increase week to week, testing is still critically important. Vaccinations are obviously on the forefront, but regular testing is still one of the most important tools that we have at our disposal in order to help us understand the prevalence of the virus in our community, and also it helps us in our ability to target cases, find cases, isolate those cases, and mitigate any spread and stop transmission. So I'm still encouraging residents, please look at our website. We have links available on how to get your vaccine, but we also have a link available to register for testing. Testing is free, and we update our schedule every Friday afternoon for the following week. Tonight, though, there are still appointments available at the Irondequoit Public Works Department from 5 to 8 o'clock. This Saturday, there's appointments available from 11 a.m. To 2 p.m. at East High School. Pre-registration is not required, so you do not have to go to the website and register. It is recommended, but it's not required. So if you're seeing this on the news tonight, please feel free to stop by the Irondequoit Public Works Department and on Saturday, East High. Again, all these locations are free. This is utilizing those shorter nasal swabs. And so these aren't the PCR tests that go all the way in the back. And you have the results available in 15 to 20 minutes. So they're very quick, it's free of charge. They're not very invasive tests to take, and helps us really be able to understand the spread in the community, get the numbers down, and to quickly isolate positive cases that exist. So with that, I will turn it over to Dr. Mendoza.
And good afternoon, everybody. And thank you for allowing us to share our news with you today. I want to say a little bit more about the numbers. We've seen the numbers improving very steadily over the last several months. And I think it's important to understand why those numbers are improving, because it will give us some validation that our efforts have been working. And I think it shines the light toward the end of the tunnel, if you will, as we look ahead to what will hopefully be warmer months and warmer days ahead, and the summer, and hopefully the resumption of more normal behavior. So when we look at these numbers, I think really there are 4 reasons why the numbers have improved as they have over the last several weeks. Number 1 is behavior, and I want to extend my thanks to the community. People have listened to the guidance. We are wearing our masks. We are avoiding those large gatherings. And I think the fruit of our efforts is now beginning to show. We see this in the new case numbers. That's the most immediate improvement. We've now begun to see it in terms of the improvements in hospitalizations. And we are actually seeing improvements also in the death numbers, thankfully. So those are all signs that are pointing in the right direction. Number 2 is seasonality. There is always a theory that these coronaviruses demonstrate some element of seasonality, meaning that there may have been a predictable improvement in February and March anyway. So that is good. And that's also pointing the direction toward further improvements as we look ahead to the spring and the summer. There is some element of the impact of natural immunity. For all of the people who have become infected, 50,000 people in our community, those individuals are now naturally immune. And so we have fewer numbers of people who are susceptible to this illness. And so that is probably the 3rd reason why we see these numbers improving. And 4th, and finally, and probably most importantly, is vaccination. And when we talk about vaccine hesitancy, we often refer to people's hesitancy to receive the vaccine, but I want to introduce the concept that we in the scientific community have also been perhaps too hesitant to speak about the benefits of this vaccine. And so in many ways, all of us, including physicians and public health officials, we always look at the studies and we always see that there is a small chance perhaps that somebody who's been vaccinated may transmit the illness. And so we're still advising that you wear your masks. But the reality is this vaccine is highly, highly effective. It has been shown essentially to prevent COVID-related deaths, essentially wiping out entirely COVID-related hospitalizations. And now we're seeing early science that is demonstrating that it makes it very, very unlikely for somebody who has been vaccinated to transmit the COVID infection to somebody else. These are all very important findings, and these are the findings that I think we need to remember. Yes, there are side effects. Yes, there are questions. Certainly there are reasons to have mistrust. But I think if we hold up the reality that this vaccine is highly effective and it is making a difference right here in our community, I hope that will serve as motivation for people to go out and get the vaccine when they are able. So just to give you a sense of where we are with regard to the vaccination program, as the county executive mentioned, there's many thousands of vaccines that are administered across the county, and we in the health department receive a large proportion of those vaccines. Many of them we will keep and use to vaccinate individuals that come to our various health department sites. And then a large proportion of them are reallocated to local practices to vaccinate people who are eligible through any of the available means. So just to give you a sense, over the last 2 weeks, we're in weeks 10 and 11 right now with regard to the vaccine. 1,800 vaccines have gone dedicated to schools, K through 12, bus drivers, 1,800 over the last 2 weeks. 2,300 have been allocated for individuals who have those medical comorbidities, so 18 and older with those medical comorbidities. And I will say that we are emphasizing seniors in that group. We want to emphasize seniors with the medical comorbidities because they are at higher risk than the average age population. Continued focus on individuals with intellectual and developmental disabilities, over 300 doses going to that group of people. We've been working very closely with Lifespan, recognizing that the typical system of opening up links doesn't always work for everybody who is in that population. So we're working with Lifespan, who is directly reaching out to their clients. Over 200 of the vaccines in the last couple of weeks have gone to them. And then childcare workers, 400. And in fact, we opened up a link a couple days ago for childcare and it didn't fill. And so we're beginning to think that many of our childcare employees have found a place to go. So we'll continue to offer it to childcare employees, but certainly we're seeing that as a good sign that many people who work in childcare have found a way to get their vaccine. Now, there's obviously a lot of concern looking ahead. Many of you probably have heard of the various COVID variants. I will say that they have been isolated here in New York State. One case of the UK variant was isolated in Ontario County, just over the border. And we've seen 2 of the South African strain isolated downstate in Nassau County. We're watching this very closely. There's no evidence to suggest that this will be more virulent than any of the other strains that we're aware of, but we will watch it very closely. And I think this is the reason why we need to go back and remember that our behavior matters, that wearing our masks matters, that staying away from large gatherings matters, and that getting the vaccine matters, because all of the evidence suggests that these vaccines are effective against the strains that are being identified. In closing, I want to say a few words about what we're learning from high-risk sports. So as you'll recall, several weeks ago, we issued the recommendation that opening to higher risk sports is reasonable. And we've been following this very closely because we want to make sure that we're keeping our athletes safe. And through 3 weeks of experience, we have not found really any examples of on-court or while in competition examples of transmission. All of the examples of COVID transmission have happened within teams, usually off the court or not while competing, and I'll say often within the adult population. And so the students themselves, the athletes themselves really have not been a major source of infection. It really is us, the adults, the coaches, the refs, and others who are on the sidelines. So I want to, again, underscore the importance that we all play as adults in making sure that we keep these athletes and their competitions and ultimately in schools safe. So with that, I will pause and turn it over to Wade Norwood.
Thank you very much, Mike, and good afternoon, all. The vaccine site in the heart of the city at the former Kodak Hawkeye parking lot on St. Paul Street in Rochester is a game changer. As you all know, the site opened yesterday, and it is an opportunity for us to advance our drive towards health equity and vaccine equity, because of the fact that Black and Latinos in the city of Rochester and other residents from disadvantaged neighborhoods who have been at the back of the line for vaccines will finally be in line at a site that's dedicated to them at its opening. As you all know, and thank you for helping us publicize, scheduling for this site is available on the New York State Am I Eligible site, or via the New York State COVID-19 hotline, 1-833 New York State for Vax. Appointments will be available for zip code specific city residents. And I am delighted to share that I was online yesterday signing up for my vaccination, as I live in zip code 14611, and I have diabetes and hypertension. And so I encourage all of my neighbors in these zip codes that are vaccine eligible to do what I have done and use these numbers and this website to get registered. In the words of the old hymn, I have said that when I am called, I will answer, and I have been listening for my name. And now that this site is opened, we all need to answer this opportunity. I have to thank the county executive and our friends at City Hall and the incredible energy that exists in the grassroots of our community for the call to action and the direct actions that have been taken that have allowed us to announce, as you just heard, 6,400 folks signing up on the first day for vaccination. That's an incredible achievement, because I've been in contact in the course of the last day with community partners and with agency heads, and I know that the outreach and engagement have only just begun. It is an incredible opportunity that we all have to be working together to make sure that we achieve the vaccine eligibility and equity that we have been moving toward from the very start of this vaccination hub at the end of the year. The city has made 311 and its libraries and its R centers available to support registration. The Community Health Workers Association of Rochester and other partners have already begun organizing for door-to-door canvassing in these zip codes. Common Ground Health has been busily at work taking the census tracts within these zip codes and prioritizing them based on the health picture and the socioeconomic pattern, so that we can make sure that we're prioritizing not only these door-to-door efforts, but the text blasts that have been planned by community partners like Refugees Helping Refugees, the robocalling that the churches have already stepped forward to say that they can engage in, the phone banking that many volunteers are signing up to engage in. These are the efforts that are going to help us make sure that as we pursue vaccine equity, that we're also recognizing digital inequity as an issue, and that we are closing and filling in and standing in that gap by our direct engagements of our neighbors, people to people. There will be postcard mailings that will be going out, and we will be making through the task force collateral material available to any who are interested in taking material and sharing it with their specific constituencies. In many ways, this bright, shining, warmer winter morning reminds me of that March morning after the ice storm in '91. When we all awakened and saw the incredible damage that had been done to our community. But in the midst of seeing that damage, we had the opportunity to notice those incredible orange extension cords that began to stretch from house to house and from home to home. And what we did and what we are doing now is recognizing that even in the midst of a storm, in the wake of trouble, that those of us who have power have the ability to share it and to power up our neighbors. And so I ask that we all join in this effort of powering up our neighbors, of holding each other accountable to making our way to the safety of continued masking, of continued adherence to social distancing and the other public health guidelines that Dr. Mendoza make us aware of, and that all of us who are eligible get vaccinated. Before I leave and close my remarks, I would be remiss if I did not mention just how incredibly well served this community is and how fortunate we are to be served by the Rochester Transit Service. RTS is providing free rides from the Transit Center to the St. Paul Street Vaccine Center, and that transportation gap is incredibly appreciated and being filled by our friends at RTS. Thank you, Mr. County Executive.
Thank you, Wade. All right, and now I think we'll take your questions. Is Julie?
Yep, thank you, County Executive. Our first question comes from Noelle Evans from WXXI.
Hi, thank you so much for taking our questions. So the mayor and the city have mentioned this call for a regular 30% allocation of vaccines to underserved populations, not just a one-time off, but routine. I'm wondering from the county level, is that possible and being considered?
Who wants to? Dr. Mendoza?
Sure, I'll start off. We have from the very beginning emphasized equity, and the numbers, if you look at them, we have some work to do. We're working on that, but we are looking at every opportunity. And we just had yesterday the opening of the sign up for the Hawkeye Center, and I think that will be a start. We need to verify that. We need to verify that the people signing up from those zip codes actually do represent the target populations that we're trying to reach. So we still do have some work to verify this, but we will do the very best we can to ensure that we have equity. The number one risk factor for suffering complications from COVID-19 is age. And so age is the most important. But we also want to make sure that we're equitable in how we distribute within the older age populations. And so we're working very closely with our partners across the community. And we do need to verify that. I think that's work that we still need to do to verify that what we are saying we're doing is what we are actually doing. But absolutely, we're not holding ourselves to a particular number. From my standpoint, we just want to keep going as fast as we can, as equitably as we can.
Okay, thank you. As a follow-up, could you talk a bit about efforts to bridge language barriers as you work to get out the word about vaccines and getting people to sign up?
I'll start, and then if Wade or Dr. Mendoza want to do that. Absolutely. So we have engaged with community partners to work on translation services and to make sure that there are folks, particularly Spanish-speaking folks, available at community pods, and to make sure those translation services are available. But this is why those community connections, community partners are so important, and through the work of the task force and working with community-based organizations to make sure that those connections are appropriate and in place. And so we do have that available at our sites, at the convention center, and through the county sites. And I know that's an important resource to be available at all vaccination sites in the county.
We think from the task force perspective that language and cultural concordance between the staff and the folks showing up to be vaccinated is critical. This is one of the essential problems of the way in which the national strategy was designed or was failed to design. The fact that there are multiple different actors in control of these different sites. This FEMA site is not controlled by the county. It would be very easy if we could simply have Dr. Mendoza and Mr. Bello make those decisions. So we, through the state, have been in contact with the representatives of FEMA and the Department of Defense to make it very clear that there are community agencies that are here, willing and ready to be present and to be supportive. The Black Nurses Association of Rochester has been forward leaning on this point, and we are hopeful that the DOD and FEMA will be responsive to understanding that they have this community as a partner and that we are here to help, and that they will have a staffing pattern that reflects this need and relies on this volunteer resource.
Thank you.
Okay, thank you so much.
Andrew Banas from 13 WAM, you're up next.
Hey guys, thanks for doing this. First question actually for Dr. Mendoza, and want to focus on the good news there about numbers going down and warmer weather. Nice day out today and yesterday, and hopefully a sign that spring is on its way. But wanted to ask about the past few days. It looks like, or maybe even the past week or so, the numbers have sort of leveled. They have gone down, but they've sort of been staying at one point. Any reasoning for that? Is that to be expected as we go down, that there's going to be some weeks or times where it stays leveled? Is there any reasoning behind that, or should we expect it to continue going down?
Well, we look at these numbers on a 7-day rolling average. So hopefully that will take out some of the day-to-day peaks and valleys, if you will. But it does feel like it's leveling off. It has not gone below 100, if I can remember, in a long time. And you'll recall back in the summertime, there was sort of a baseline sort of level of cases that were happening every day. I'm hopeful, actually, that we'll go below 100. But right now, it doesn't yet look like that. So I think we need to keep our focus on vaccinations, because I think that's probably the greatest driver after the wearing our masks, the greatest driver of preventing new cases. But I would anticipate that as the vaccination rates pick up, that number will go below 100 at some point. That's certainly our hope. So I think we just need to keep our foot on the gas and keep our focus where it ought to be.
And I wanted to follow up with big thing happening tomorrow. I know this is a state decision, but nursing homes will allow visitors in under those new protocols tomorrow. Have you, again, I know it's a state thing, but as public health commissioner for the county, any sort of just insight to your recommendations or suggestions for how people can do that safely and what people should expect as they finally get to reunite inside with loved ones?
Well, this has been a long time coming. The families who have been impacted by this have certainly borne the brunt of this awful tragedy, more so than any other family. I think this is a change, long time coming. I am supportive of it. I don't think that we should be very careful not to lose our guard. So getting the vaccine, many of our nursing home residents have already received their vaccine. And so really it's on us as the community visiting our loved ones to make sure that we follow the guidelines and are safe. Testing as appropriate, but most importantly, wearing your masks, keeping your distance when you're in gatherings or monitoring your gatherings. And for those of us who are visiting, to get our vaccines ourselves. I've said many times that there's no zero risk path out of a pandemic. But when you look at the balance of mental health and the social connection that's so important, particularly people who are older in age, I think we have to make choices and we have to be responsible about them. So as we visit our loved ones for the first time in many, many months, we owe it to them and to our community and to the nursing homes who've borne a disproportionate brunt of COVID-19 to be responsible and to follow the guidelines.
Thank you, Andrew. Patty Singer from Minority Reporter.
Hi, thank you. So there's been a lot of talk about the numbers of people who are getting vaccinated, and the state does not seem to be cooperating and breaking it down on a zip code level and making it easy for people to be tracking this. For equity sake, how will the county track and publish the numbers of actual vaccines administered through this site so that we, the public, can track the equity and see that it is actually working as intended?
Patty, are you referring to the Hawkeye site?
Yes, yeah. In particular, yes.
Yeah, no, that I appreciate that question. And Patty, this goes back to the question I think earlier. So the first thing you have to, we've known from the beginning that prioritized an equitable distribution of the vaccine and knew, that there's going to have to be intentional efforts to make sure that everybody in Monroe County has access. And with the Hawkeye site coming online, I think is a game changer. And one of the ways to make sure that that you are having that equitable distribution is you have to have access to data. Last week, I was on the call with the state and the governor's office talking just about this very issue, asking for that data so that we can start to see what we know. We can see it with our eyes, we know it by being out in the community, but we have to have the data so that we can react to it, and then we can measure our progress and measure the impact that we're having as we take these steps. Not just as a county though, but as a community. There's a lot of different community partners that are engaged in the distribution of vaccines while still trying to follow those eligibility, not trying to, but you have to follow the eligibility criteria that's laid out. And so the state responded to that request, has started publishing that data last week, midweek. Last week, continue to publish that. And then we had requested data on the Hawkeye site, which is why we know today that there were 6,400 appointments being made yesterday. So we're going to continue to request that information. I'm hoping to have daily reports on that information from the state. The county doesn't have it, so it's not reported to us directly as appointments are made, but we're going to continue to request that data from the state and share that with the community so that we can measure our progress, because we don't know our progress unless we have data to react to, and we have to have that data. It is so critical to this effort.
Right, but families were requesting nursing home data for months, and that didn't come. What is the county going to do on its own, counting people walking in to make sure to respond to the public and just cut the state out of this, because they've shown they're not really good with numbers on these things?
Well, Patty, like I said, we're going to request the data. We want the data. Like I said, we're in a position to announce how many people have made an appointment today. But you know, we don't know who signed up at the state-run site. This is run by the state and federal governments.
Right, but you'll know who shows up and count then. That's what I'm saying. Can't you do counting the data as people come in and leave? No, that's third question. Sorry, Julie.
No, it's okay.
Patty, this is Wade Norwood, and
Yeah.
count exact. What I would suggest, Patty, is that we've been able to get keyhole view of activity at sites. We really do need to leverage the fact that all vaccination information gets uploaded into the New York State Immunization Information System, NISIS. And what we need, to your point, is not to just simply have the state report to us out of NISIS, but how do we get the NISIS data for our region downloaded to us as raw data so that we can match it with the information that would allow us to have looks at not just race and ethnicity, but also geography as well. The advocacy of this community has paid off in that the state government has signaled that it will make that information available to our RIO. It will take us some time to make sure that that actually occurs, to scrub the data and turn it into information. But if we are able to patiently and methodically work our way through that data capture and analysis, we should, by the time we get to April, have an ongoing sustainable stream of information that the hub can share publicly, and we can all be part of the accountability chain by all having access to transparent data. And that's been one of the commitments that we made when we stood up and announced this effort at the turn of the year, that in addition to pursuing equity, an inclusive process and a bottoms-up process, that it would also be transparent. Because the bottom line is, however well we're doing now really is only a formative assessment. The real judgment is when this is over, have we achieved equity? And we need to have the numbers that are the facts that will allow us to answer that question.
Thank you, Patty. Our next question, it looks like Andrew Freeman is here from Spectrum. Andrew?
Hi, how's everyone doing today? Thanks for chatting with us. I was just wondering, this is just Andrew, my counterpart kind of touched on this, but I just want to talk a little more about nursing home visitation guidance that begins tomorrow. And I'm just maybe maybe hear from Mr. Bello on just, you know, how does the county feel about this? Is the county confident and ready for this to start tomorrow?
Yeah, I mean, you know, listen, I'm glad that visitation nursing homes is beginning to open up more. I think that there's a few crucial factors, though, that led, I think, the state to make that decision and why I feel comfortable with it. One is the level of vaccination. Prioritizing nursing home residents from the beginning and staff in the nursing homes was critically important, and I think was the right thing to do, because nursing homes have borne the brunt of the impact of this virus from the beginning. And making sure that nursing home residents, the staff who are working in there, are safe and protected, I think was the #1 priority. That's why they were prioritized for vaccination. Now that the vaccination is there and such a high rate of vaccination has been taken by nursing home residents, I'm confident this is the right thing to do, but it has to be coupled with testing, which I think was the other key piece to the state's guidance that they put forward, which was, I know there's triggers in terms of different positivity rates for how much testing, whether it's required, but I would encourage testing, because testing really is how you can isolate cases, particularly, and make sure that you mitigate that spread, but continue to protect those residents and also the staff who work in those buildings from spreading the virus. So I think the timing is right. We've been talking about this for a few weeks. And I think that continuing to prioritize vaccination and testing amongst this population is how we're able to continue to feel comfortable with the state's decision to open up visitation.
Thank you. My follow-up question is for Dr. Mendoza. Dr. Mendoza, are you able to make a call on schools going from 6 to 3 feet in distance? Or if you don't have that power, if is that a call you would make if it was given to you?
So no, I don't have the authority to make that call. I am following the data, I am following the guidelines, but ultimately those guidelines have to be acceptable or permissible under the New York State Department of Health, who is the body that does have the authority. But I'd like to have as much role in it as possible. The challenge, of course, is that we're one county and we have to work collaboratively across the region. And so to some degree, I think the better part would be for the state to change the guidelines so that it can apply across the entire region, because there are students who live in one county and go to school in another, for example. And so I think I've advocated from the start to have consistency across our region and certainly within our county, and that it be all based in evidence to the extent possible. So, we're following the CDC guidelines. That's been the best roadmap seen to date to show the path toward reopening schools. But at the end of the day, what matters is whether the state health department will change any of their guidelines, or if the current CDC guidelines fall within the purview of the existing DOH regulations.
But would you support going from 6 feet to 3 feet at schools? Maybe I phrased the question poorly.
So there is no evidence that studies 3 feet. We know that 6 feet is the gold standard. And so the only guidance there is to lessening that distance, and nowhere is it mentioned in any guidance that 3 feet is the magical distance. You want to maximize as much as possible, but at a certain community prevalence level, the 6 feet isn't as important as it is right now. Right now, we are not in a position, if you go by the guidelines from the CDC, to reopen schools to decrease at all from the 6 feet. 6 feet is required right now, given our current rates. But if we get down to that 50 per 100,000 over a 7-day period of new cases, you'll see in the guidelines that it says to maximize the 6 feet to the greatest extent possible, which doesn't mean go down to 3 feet. It means try to accomplish whatever the goal is that you're trying to accomplish and keep the distance as close as possible to 6 feet. Okay, this isn't a license to get rid of distancing altogether, because that would be unwise. And nowhere is it written in any of the guidance that 3 feet is the next step. Something shorter than 6 feet would be the next step, maybe 5 feet. But we've got to be, rooted in science, and nowhere in the guidance has anybody really ever advocated for 3 feet.
Thank you so much.
Thank you, Andrew. Our next question comes from Brian Sharp at the Democrat and Chronicle. Brian may have cut out. He submitted his questions. The first is to you, Dr. Mendoza. What is your view on vaccinated people gathering unmasked, and why, and how long do you foresee masking having to continue?
There you go. Among a group of people who've been vaccinated, I think it's perfectly reasonable for them to take their masks off. I think it's important for people to realize that, if people who are all vaccinated in a room, who've been vaccinated and have waited the appropriate period, usually 2 weeks after their second dose in the case of these 2-dose vaccine series, once you're considered vaccinated, if we can't start reducing some of our precautions, then the next logical question is, why get vaccinated? So I do think that once a group of people is fully vaccinated, and we've clearly outlined the guidelines for what that might be, I think it makes perfect sense for people to no longer need to wear their masks. Now, in public, I think it's still very important, even for those of us who have received our vaccines, to wear our masks, because I think this is sort of a community effort, and we want to show a unified front. But from the standpoint of individuals who've been vaccinated, I think it's safe for them to take their masks off when they're in the company of other fully vaccinated individuals.
The second question is also for you, Dr. Mendoza. When will we see vaccinations available to people who are homebound because of health or mobility?
Well, we have vaccine available. The challenge is in getting to their homes. And this is a problem that is not going to go away because people who are homebound are likely always going to be homebound. So this is an area that we're working with our community partners on. We in the health department don't have the army of people that would be necessary to go into everybody's homes on a universal basis. We've done, individual people for various reasons, but we're not at the point right now where we can do this across the entire county. So, but this is an important priority for us. So we're working with home care agencies, churches, Lifespan, to develop that bandwidth. But the one benefit of people who are homebound is that they themselves don't actually have that much risk because they're not out in the community as much. It's really the family members and the caregivers who we also want to address. And so we look at this really as a partnership, both the individuals who's homebound as well as their household and people who are caring for them. And so this is a complicated problem, but it's one that we're definitely working on.
Thank you, Dr. Mendoza. Next question comes from Berkeley Breen from WHEC.
Thank you, Julie. Dr. Mendoza, the situation at School 29 in the city, is that causing you any more concern with reopening schools?
No. We have a pretty well-oiled machine when it comes to evaluating what happens in schools. And when we were made aware of what happened in School 29, we had our usual approach of doing the case investigation, contact tracing. We have no evidence of any spread to any of the students in that building. The one example of in-school transmission was between two staff members, and they were not wearing their masks. So that is unfortunately an area of improvement for the school and for all of us. A reminder that wearing our masks indoors is very important. But no, this doesn't throw a wrench into my feeling about ensuring that we're data-driven and that we rely on contact tracing to guide our decisions about reopening schools.
The UK strain in Ontario County, can you elaborate on that a little bit? What happened? Do we know how it got here, and how is that being handled?
Well, that would be something that the Ontario County Health Department would be in a better position to comment on because they would have been doing the contact tracing for that individual. But I will say that it's no surprise. I would be surprised if the UK strain wasn't already here in Monroe County. Most experts think that it's already in a region well before we first detected on testing. So my advice is, it's here. It's not surprising. We need to continue to get vaccinated, wear our masks, and carry out all of the usual precautions.
Thank you, Berkeley. Our final question today comes from Atia Collins at WROC. And it looks like we may have lost the county executive's feed. If you have any questions for him, we can take those later.
Okay. Or if he's back, I did have a question for Bello if he's back there.
Back. Yep.
Okay, perfect. Yes, thank you for taking the questions. Adam Bello, my question for you is Cayuga County Health Department in Central New York recently fined a Wegmans $1,000 for not enforcing their mask mandate. We're wondering if that's something that would be considered here in Monroe County or something similar considered for businesses here.
Yeah, I think enforcement is important. I always have from the beginning of the pandemic. This is a community effort. The science is real. We need to wear masks. We need to follow the protocols and precautions that exist. They exist for a reason, and it's to bring down the spread. And while we talk a lot about our numbers being in the right direction, we started off today's briefing with that, and and we are in a good position now. The numbers are low, they're steady, but continue to go down. That doesn't mean we're not still in the midst of a global pandemic. The vaccines are here. A good number of people have been vaccinated, but an awful lot of people have not. While we used to have over 600 people hospitalized a month ago, there's still over 200 people and family members here who are in the hospital. There's dozens of people still in the ICU fighting for their lives. We are still losing family members to this disease every day. So we need to work together as a community to continue to follow the science, continue to follow the guidelines. And I do think there should be penalties in place and enforcement when those guidelines and those public health rules that have been set forth by the state are violated.
Thank you. And then my second question is for Dr. Mendoza. You talked a lot about schools. We're wondering what exactly is the process with fully reopening schools? Do districts submit those plans to the county health department or to the state department? And to follow up with that, do you support fully reopening schools?
So from the beginning, I've supported fully reopening schools as long as it can be done safely. And so right now, to fully reopen schools 5 days a week, as though it was 2019, would not be safe. The process, though, is that the school districts submit their plans to the state health department, as they did early last fall. And the state health department is who approves those plans, and then the districts follow through on the plan that they submitted to the state. And I will say that they have done a great job following through on those plans, because the numbers, as you all know, within our schools has been kept to really a bare minimum. But I don't have any role in approving those plans. I don't review those plans. My role really is as a consultant providing clinical advice. But no, I would not support opening schools 5 days a week fully right now. I do think that if and when that time comes, and I hope it comes soon, if our numbers can continue to fall and the state health department changes the regulations or communicates the recommendations such that the CDC guidelines can fall within the state regulations, I think there is a path. But if you look at the CDC guidelines, there is a statement that we still need to reserve an option for people who want to be remote. There are people who need, or for whatever reason, prefer to be remote, and I think we need to honor that. So fully reopening schools isn't going to be like it was in 2019. It will be a different flavor of that, but we want to get move in that direction. But at the end of the day, it all falls to the state health department.
Okay, County Executive, any closing statements?
No, thank you all for this. And one thing I'll just follow up to on the last that last question too. The fact that we even know about are asking about the fine from Central New York. I was made aware of that this morning. I mean, those are isolated cases. I mean, for the most part, this community has really come together and is following the guidelines, following the science. That's why our numbers are where they are. That's why we're down to 2% positivity rate. And so we always, I know a lot of times we focus on the negative, but there's also a lot of good stories to tell. And there's a lot of examples of the community coming together, doing the right thing, following the science, wearing our masks, understanding that wearing a mask is just as much about protecting people around you as it is protecting yourself. And so that's, and we understand then that it's our duty as good citizens to follow those guidelines, not because we might face a penalty, right? And a business doesn't enforce the guidelines inside their walls because they might get penalized, but you follow the guidelines and you enforce them within your store or business because it's the right thing to do to protect your community and protect your family and your friends. It's how we get to the point where while we're waiting to vaccinate everyone, we can open things back up again. It's why these guidelines are being expanded to open up wedding venues again, and to, going into the spring, open up amusement parks, and to open up visitation to nursing homes and families. We have residents in nursing homes that haven't seen their families in a year. And, we get to that point by protecting each other, even if you are young and healthy and feel like you're going to get this virus and you'll get through it just fine. That may be. But you may come in contact with somebody else in a store or at work or at school or someplace else who would not be fine if they contracted the virus. And that's why it's all our personal responsibility to do what we can to keep it down. So that's why we continue to do this. So I do want to focus on the positive as well, because there has really been a great effort. We went through some very hard times early on in the pandemic. Right after Halloween, we started to see that spike coming right before Thanksgiving and through Christmas. That was a hard time. A lot of families couldn't see each other during the holiday period, but we got through it. We're going to vaccinate people, and we continue to do this. The next holiday season will look a lot more back to normal and what we would like it to see. So thank you all very much. Appreciate it.